everyone, it's Bailey, one of the KU Occupational Therapy students, and today we're going to be talking about positioning. Specifically, we're going to be talking about proper positioning for our bodies in various settings such as laying in bed, sitting upright in a chair, if you use a wheelchair, proper positioning while sitting in our wheelchair. And I feel like this is a really important topic to talk about because after a stroke, sometimes moving certain parts of our body on our own is difficult. Making sure we're positioning our body properly is really important to avoid other medical problems arising. Some medical problems that could arise if we're not positioning properly or shifting our weight enough can be pressure sores, having chest infections, getting blood clots in our legs, swelling, also experiencing urinary tract infections, having less range of motion in our joints. Also, we can experience some back pain, have some blood pressure problems, have muscle shrinkage and contractures. So this is all really important that we're positioning our body correctly. And also, you can experience aspiration, and this is in relation to proper positioning when we're swallowing, eating, and drinking to avoid that aspiration and choking. So that's another aspect of really the importance of proper positioning for when we're eating and drinking and swallowing. Also, overall, proper positioning is really important for comfort for our body. And also, if you're positioning yourself properly, you're going to have improved confidence and better interactions with others. And so I hope that this information is really helpful for you. I also want to speak directly to participants, but also to your care partners and your caregivers. This information is important for all of you in the sense of in the videos, you're going to see me positioning a patient. So kind of from a caregiver or care partner perspective of putting your loved one or the person you're caring for into proper positioning. Also, if you are a participant who has better movement and can position yourself on your own, you can do all these positioning on your own, but you're just going to see it from the perspective of me as a caregiver putting the participant into proper positioning. I hope this information is useful for you and you enjoy the video.
Positioning a patient in bed is important for maintaining alignment and for preventing bed sores, foot drop, and contractures. When positioning a patient in bed, supportive devices such as pillows, rolls, and blankets, along with repositioning, can aid in providing comfort and safety. In this video, the left side is going to be the affected side, and so we're going to be focusing on laying on that affected side. So when you're laying on your affected side, use 1 or 2 pillows for your head. Your affected shoulders should be positioned comfortably. In this video, I'm showing putting that affected arm on top of a pillow for more comfort. Place your unaffected leg forward on 1 or 2 pillows. Place more pillows in front and behind you. This is an important position as it increases awareness of your affected side as you are lying on the bed. It also leaves your unaffected side available for tasks. When lying on your unaffected side, use 1 or 2 pillows for your head. Your affected shoulders should be forward with your arms supported on another pillow. Place your affected leg backward on 1 or 2 more pillows. Place a pillow behind you. This position can let you practice doing tasks with your affected side if possible. When lying on your back, place 3 pillows supporting both your shoulders and your head. Place your affected arm on a 4th pillow to provide comfort and better support. Make sure to keep your feet in a neutral position. And lastly, put a pillow behind your knees in order to support and also relieve pressure that is put on the back. When sitting in bed, make sure you're sitting upright and supported by pillows. Place both arms on pillows for comfort and support. Keep your legs supported for comfort. Again, this is where I would say put a pillow behind your knees in order to provide relief from pressure on your back. Also remember that sitting in bed is usually only advised for limited periods since it is hard to keep up proper posture in this position. When sitting in a chair or a wheelchair, we want to avoid the pelvic tilt, which occurs when you're slouched or leaning back, which is being displayed here. What we want is your hips to be back in the chair at a neutral tilt with your feet flat on the floor. This is really important for putting less pressure on your hips and on your back. Sitting in a chair or a wheelchair, your feet should be flat on the floor or flat on the footrests, and your knees directly above your feet. Make sure you sit well back into the center of the chair or wheelchair and place your arms well forward onto the table in front of you or on your armrests. Here I have a pillow placed under the arm on the armrest of the affected arm. Also, I have a pillow behind the back for optimal comfort and positioning.
Okay, so when we're just in a standing position, if we're talking to someone, what we want to do is we want to have our feet shoulder width apart, and then we want to have our standing up tall and straight with our shoulders back, and we're tucking our tummy in, and our arms can hang naturally at our sides, and that's a really good standing position. And also, if you're going to be in a standing position for a long time, we want to switch the weight bearing onto each foot just to kind of shift that weight so we're not always focusing the weight on just one side of our body. And that's kind of some good proper standing positions, especially if you're going to be standing for a long periods of time. So sometimes after experiencing a stroke, we have some difficulty with our walking and our balance, and so a walker might be the best option for you for safety when you're standing and you're walking. And so one of the most important things with our standing position and using a walker is we need to make sure that our walker is set to our height. And so if you can see here that when she hangs her arms down here, the bars go right at her wrists, and that's where we want to be, so then when she holds on, she's not slouched over, she's still in a good standing position for when she moves with that walker. And I'm sure you've been shown with your walker how you can adjust the height. You're just turning your walker over, and you can see where the little pins are at, and that's how you can adjust it to your height. And that's how you can have proper standing position with your walker.